Hey guys, so yesterday I went to the town hall meeting for the Bouquet Canyon Safety and Realignment Project, and it was enlightening to say the least. Um, Safety and realignment. That word safety seems a bit of a stretch because with the proposed plans, it really sounds like they didn't consider safety as much as they should have. Okay, so what are they proposing? So all this here is Bouquet Canyon Road. The red is the sections they plan to close off entirely. Now, our lifeline is here, Ben's Road. So we're pretty much screwed. So we're gonna have to start using Alaminos, which, during school season, we have Bouquet Early Learning Academy, we have Rosedale. So it's going to be bad, to say the least. Additionally, we can go up Ben's Road up to Copper Hill. However, with this road being closed, that means that all the people coming up from the north are going to be diverted. So they're going to be, taking Copper Hill. Now, during the meeting yesterday, they promised and promised that drivers would not go into the residential streets, such as Alaminos, that is our street. But come on, who can really promise that? People are going to try and find the fastest way to get to their destination. So sooner or later, all these small streets are going to suffer the consequences of this closure, that closure, that closure. No, these dashed lines, that means they're soft closure. So there are, cul-de-sacs in between here. So obviously they can't really close that section off entirely. Oh yeah. And then coming from the north, from Shadow Valley, so this will be open for those residents, but they have to cut through David Way, and eventually make it all the way down to Copper Hill. So again, more congestion. Now they did mention that they were even considering closing off Shadow Valley. So the people coming from that side, where are they going to go? Vasquez Road? That's just going to be a recipe for disaster if they opt to close Shadow Valley as well. Okay, and this is another picture that they showed us of the detour improvements. Sorry, of the detour offset improvements, because honestly, it's not an improvement at all. We already went through this section here. Oh, and another thing that was brought up over and over again was this area here. All the small businesses, with this being closed off, they're going to suffer one way or another, whether the city wants to believe it or not. Nobody's going to want to go out of their way, especially if they live up here, to come down to, do whatever they have to do here and then go all the way around to get to their destination, or, go any other way. But these people here, unfortunately, are going to suffer. So again, so this is the alleged alternative road. And then, we have, what is that there? Is that Haskell? Yeah, I do think this is Haskell here. So with all this closed, the schools are going to be affected no matter what. We have Rosedale, we have Saugus, we have Bouquet Early Learning Academy. As it is, it's usually already bad from Haskell all the way up to Centurion Way. And when school starts and the road gets closed, that traffic unfortunately is going to spill over. Additionally with that, you have all these kids that take the bus. I see a lot of kids waiting for the bus on Ben's. So that actually was not discussed. I'm assuming they're going to reroute the bus, but these kids already get up super early. I see them sometimes at 7:15 already waiting out there. So what's the plan? With all this traffic that we're going to get, are they supposed to go and wait for the bus an additional 15 to 20 minutes earlier? That's not fair. So again, improvements for who? The kids are going to start suffering whether they want to believe it or not. And here is a close-up of the alleged improvement. So again, closure, soft closure, hard closure is the reds, hard closure, and then the detours they want us to take. So usually the way we go, we're off here somewhere, so we go up, out Bends, down Bouquet, off to Plum. So now, since our lifeline is going to be closed, they're telling me that I have to go all the way out here, go this way, and either go that way or come this way. I know I can't go that way because we're going to start getting all this spillover from up here. So that's going to be a nightmare. And yeah, so they're just making me go around in a big circle. So anyway, so again, we're back here. I don't think they gave us a date of when they're supposed to start closing off these roads. I think it was mentioned sometime in January, possibly February, and this is supposed to run for 11 to 12 months. So good luck to all of us that are out in this area. Now, something that wasn't discussed, they're planning to build, I think they said 365 new homes or 350, something along the 300s number. And this is probably not the town hall meeting was probably not the area to bring it up, the location to bring, the setting to bring it up. But we're going to get thousands more people, yet we still have this very small hospital. So, they talked about economic impact, environmental impact, but nobody, absolutely nobody, talked about the health impact. I mean, Henry Mayo doesn't even have a pediatric ward. Okay. Now, I know I was talking to my neighbors, with everything going on in society, a lot of people are losing health insurance. So, oftentimes, I read thousands upon thousands of medical reports in my medical career. A lot of times, something that I would read is the patient does not go to the doctor because they do not have insurance and don't want to be stuck with those medical bills. So in an emergency, they're telling us, yeah, emergency personnel are going to be able to get to you no matter what. But when you don't have insurance, you're not going to want to call emergency personnel. Who's going to be able to afford an ambulance charge of hundreds of dollars, or God forbid, an emergency for a child or anybody really? I'm just saying children in particular because, again, we don't have the pediatric ward out here. But God forbid, and a helicopter ride, that's easily going to go into the thousands. So Santa Clarita needs to get their S together. We need another hospital. I know that they have their agreement, their contract, whatever, where they promised whoever that Henry May would be the only hospital in the area. But Santa Clarita is so big. I was reading that I think it's grown between 50 and 75,000, by 50 to 79,000 people in the past decade. They're building homes everywhere. That number is undoubtedly going to increase before we know it. In case of an emergency, Henry Mayo cannot handle the influx of patients should a massive earthquake happen, whatever happens. So I don't know. I guess we'll wait and see. Maybe 5-10 years down the line, we'll look back at this and think otherwise. But right now, it's just not looking that great. Tensions are high. Community morale is low. So let's see where we are 12 months from now.